posterity. This is an open event. So, and for the website, you can check out the website at socialinnovationinhealth.org. And everything is open. So it's a public event. It's for attribution. Nothing will be confidential. Images from the event may be shared online. A WhatsApp thread is already, I think the technical term here is blowing up, and will feature key images and texts. And if you're joining us through Zoom, the default is to be muted and to not have video. This will help our friends who have lower bandwidth. If you do have more bandwidth, feel free to jump on the YouTube live stream. And also, and importantly, put down your mobile phone, unless you're joining us through WhatsApp. Cull all of your open tabs. And by that, I mean, take all your open browser windows and reduce them so that you are giving us your undivided attention. Give us your full attention. We will deliver, I promise. And so you can see here on this slide the YouTube live stream link. The objectives you can see here on the slide, but really the COVID-19 pandemic has profoundly altered health services for people across the globe. Travel to hospitals is restricted, and many health facilities are on the brink of financial ruin. For vulnerable groups who've already been marginalized by their gender, race, nationality, these are difficult times. However, the COVID-19 crisis also provides unique opportunities for creating social innovation. Social innovation here refers to inclusive solutions that meet the needs of end users through a multi-stakeholder, community-engaged process to address the healthcare delivery gap. And in this slide, you can see a co-created design-a-thon. So this is a short sprint-like participatory event that was hosted in Lagos, Nigeria. And these young people were responsible for creating their own HIV self-testing services. And this is really a nice example of social innovation in action. Today, we're gonna hear from 3 panels. The 3 panels will each underline the power of social innovation in responding to emergencies. First, we'll go to Latin America, where the SIHI Hub will discuss mobilizing community-based COVID-19 responses. Dr. Nancy Saravia, who leads this hub, will get under the hood of Mamas del Rio, helping us to understand this innovation, how it works, and how it leverages community wisdom for COVID-19 control. Then we'll head to Malawi, where Barwani Sisaka, who's the SIHI Malawi Hub Manager, and Dr. Rosanna Peeling, who's the Chair of Diagnostics at LSHTM, will moderate the panel Transitioning Social Innovation to Scale, COVID-19 National Hotline. The Malawi Hub identified this innovation several years ago, and it's been repurposed during COVID-19 to enhance COVID-19 case detection, referral, and community awareness. Finally, and sorry about that. So this is our second panel in SIHI Malawi, moderated by Barwani and Dr. Peeling. And I think this is a really interesting example of transitioning social innovation to scale and repurposing it during the COVID-19 pandemic. And then finally, we will head to the Philippines, where Dr. Noel Juban will discuss multi-sectoral partnerships to spur social innovation in health. Dr. Juban leads the SIHI Philippines Hub and co-leads the SIHI Secretariat, and he's going to help us understand how partnerships have come together and spurred innovation in the Philippines. And a final few words of thanks. First, a note about our supporters. The SIHI network is supported by TDR, the Special Program for Research and Training in Tropical Diseases, and co-sponsored by UNDP. UNICEF, the World Bank, and WHO. And WHO has a number of different supporters. For a full list, you can see the website here. In addition, TDR receives funding from SIDA, the Swedish International Development Cooperation Agency, to support the SIHI network. I'd also like to call out the co-organizing institutions. You can see a full list of the groups that helped to organize this event. The Ahimsa Fund, Foundation Mérieux, Health Innovation Exchange, the London School of Hygiene and Tropical Medicine, the University of the Philippines, Manila, SESH, SIDA, TDR, and UNAIDS. And on the right, you can see a list of SIHI partners and hubs. And so a big thank you to all of the group and all of the individuals and teams that have worked to make this possible. And I'd also like to briefly introduce Dr. Beatrice Halpap. So Dr. Halpap has been at TDR for over 2 decades, and she is a member of the TDR senior management team. She's an enthusiastic champion of social innovation and health within TDR, within the WHO, but then also beyond. She's visited several of the SIHI hubs and has seen how they can enable ecosystems of innovation. And Dr. Halpap is really a brilliant champion of this cause. So over to you, Dr. Halpap.
Thank you, Joe. Thank you, everyone, and thank you for this nice introduction and a warm welcome to everyone on the behalf of SIHI and on the behalf of TDR. So TDR, building upon, I'd like to give you a little story of how SIHI came and what it is really, this initiative. So it started all in 2014, and building upon the work of TDR on community engagement, we teamed up with the London School of Hygiene and Tropical Medicine, with the Bertha Center for Social Innovation at UCT in South Africa, and with the Scholes Center for Social Entrepreneurship at Oxford University, and established SIHI, that global network of partners, in order to advance social innovation in healthcare delivery through research to generate evidence of what works and what doesn't work, through capacity building to ensure that countries are in the leadership role, and advocacy. As we started social innovation, it was clear that they have a great value in order to address healthcare delivery. However, it became also very clear that there was a lack of evidence in order to enhance or ensure effectiveness of social innovations and also their sustainability, evidence to demonstrate their impact, and evidence to scale up if necessary or adjust and replicate. So the SIHI vision was then set as really seeing an increasing number of research institutions in low and middle income countries to play a leadership role in advancing community engaged social innovation and accelerating universal health coverage. We at SIHI have a two-pillar approach. One is to create an enabling environment at the global, national, and local level. This is to raise awareness of the power of community engaged social innovation, also create partnerships. We also, the second pillar, it is about to engage countries. And this is done through the establishment of the SIHI country hubs that you will be hearing from today. The initial country hubs, so there were the South African, the Bertha Center hub that has helped to establish hubs in China, in Latin America, Malawi, Philippines, and Uganda. And since this year, these hubs have managed to actually engage new research institutions in Ghana, Honduras, Indonesia, Nigeria, and Rwanda to set up additional hubs, and we welcome them today. And this year is a really nice year. We have established the SIHI Secretariat in the Philippines and demonstrating a real leadership from low and middle income countries. So we'd like to thank you and invite you into this event, as we have seen that social innovation definitely has a role to play in addressing and responding to health emergencies. And we are really looking forward to this discussion and to your feedback on the chats. Over. Thank you. Joe? So I think Joe must have disconnected.
Shall I start?
Yeah,
No.
Go ahead, Nancy. Take it over.
Okay.
Over to you.
So, warm greetings to everyone, and welcome to the panel, Mobilizing Community-Based COVID-19 Responses. My name is Nancy Saravia, and I'm the Director of CIDEM, the Centro Internacional de Entrenamiento and Investigaciones Médicas in Cali, Colombia, and Director of the Social Innovation and Health Initiative in Latin America and the Caribbean, SIHI LAC Hub. We are fortunate today to have an exceptional group of panelists from Latin America to discuss how communities, which are truly at the heart of social innovation, can mobilize COVID-19 responses. The social innovation Mamás del Río, Mothers of the River, provides a particularly instructive experience of community mobilization for health. Before we get started, I would like to introduce our panelists. First, Diana Castro, PhD in Social Sciences and Research Professor at the Universidad de Antioquia in Medellin, was the research leader of the SIHI LAC Hub in 2018 and 2019, and is now a valued special advisor. Diana was a member of the health team that visited Mamás del Rio project in Peru, where she had the opportunity to learn firsthand about this very interesting innovation. Magali Blas is the Chief Executive Officer of Mamás del Rio. She is a medical doctor and PhD in epidemiology and a faculty associate at the University of Washington in Seattle. Luis Gabriel Cuervo is a physician and specialist in family medicine with an MSc in clinical epidemiology. He is currently a doctoral candidate in research methodology and public health, and is the Senior Advisor in Research for Health at the Pan American Health Organization, headquarters in Washington, D.C. He is also a Special Advisor to our SIHI LAC team. Okay, is everybody there on the screen, the panelists? Okay. Our panel members have seen and experienced the fascinating social innovation Mamás del Rio from different perspectives. Our goal today is a dynamic discussion allowing interactions between panelists and the audience, rather than a PowerPoint presentation. So I would like to start with Diana. Many in the audience, Diana, today are not familiar with social innovation for health research hubs. Could you please tell us about the SIHI LAC Hub and what it does?
Thank you, Dr. Nancy, for your introduction. Greeting everyone. Our hub is part of the Social Innovation in Health Network that unites academic, intergovernmental, community-based organizations, and other champions in a common purpose. The Latin American and the Caribbean Hub is hosted by CIDEM, a Colombian Research and Training Center, in partnership with the Pan American Health Organization and SIHI University. Our efforts are focus on four main objectives. First, objectives to generate new knowledge through research in social innovation in health. Second, to raise awareness of social innovation in health in the region and identify initiatives with the potential to inspire change and improve the health of communities. So far, we have identified 8 initiatives, 3 in Central America and 5 in South America. Today, we will discuss Mamas del Rio, which is one of these initiatives. Our third objective is to promote synergies and collaboration among stakeholders. And finally, the fourth objective is to strengthen capacity to research and innovation for health. We seek to improve access to equity in health and strengthen health systems. We aim to advance the United Nations Sustainable Development Goals working with communities. And for this, the hub brings together interdisciplinary and intersectoral teams and champions and other champions to drive change. We began in Colombia in 2017, and this year, a node in Honduras has opened.
Thank you so much, Diana. Now, moving to the Peruvian Amazon, Diana, what is so special about Mamas del Rio in relation with the Social Innovation and Health Initiative?
Sorry. Mamas del Rio was identified in the 2019 Call for Innovation in the Andean region, covering Bolivia, Colombia, Ecuador, Peru, and Venezuela. Mamas del Rio operates in the Peruvian Amazon, and something distinctive about this initiative is that fulfilled each of the principles of social innovation. For example, by addressing the needs raised by the communities that it supports, by enhancing leadership participation and empowerment of communities beyond maternal and neonatal health, by strengthening health systems by aligning community, NGOs, and intergovernmental efforts, thus all stakeholders pulling the same direction, by adapting and responding to existing and emerging needs of the communities. For example, the response to the COVID pandemic among the communities of the Peruvian Amazon. Another important social innovation principle that the innovation fulfills is that it have achieved sociability and scalability at the national and regional level. During my trips to the Peruvian Amazon to develop the case study, I had the opportunity to learn about the innovation for traditional birth attendants, community health workers, from the mothers and families participating in the program. All attested to how Mamas del Rio benefit the community by promoving clean deliveries and healthy newborns as a new normal.
That's great. Thank you, Diana, for introducing us to Mamas del Rio. Now we would like to turn to Dr. Blas. Mamas del Rio was focused on community mobilization from the very start. Please tell us, Magali, about the importance of communities in driving social innovation to meet old and new health challenges.
Thanks for the question, Nancy. In fact, communities are a key force that will make an innovation succeed or die. And there are 2 key parts in designing a health innovation. First, we have to understand what are the drivers that affect people's health in the community, so that we as an innovators use community impulse in designing relevant interventions to improve the health of the community. And second, we have to find how to embed the interventions within the culture and beliefs of the community so that this community can adapt the intervention, embrace it, and make it sustainable. In Mamás del Rio, we work in areas that are along 350 kilometers of the rivers of the Peruvian, and soon we are working with the Colombian Amazon, where there is no access to clean water, electricity, or sanitation. In the areas where we work, 65% of women deliver at home without the care of any trained healthcare provider, and only 8% of newborns have a health checkup. In our program, we train community health workers from these same communities to identify a pregnancy early and begin prenatal controls, and to perform home visits to pregnant women and newborns. The community health workers use tablet-based applications to gather health data that is shared with public health staff from the local government, who review this information to act on it. The tablet also has educational contents in the form of pictures and videos that are used during these visits. And also, community health workers bring safe delivery kits to the families to enable for clean births at home. Remember that the majority of women deliver at home. They also are able to weigh the newborn and refer those newborns who need immediate care. In rural areas of the Amazon, the leading causes of neonatal deaths are preventable, such as infections and prematurity. We work with community health workers and traditional birth attendants to change these by encouraging clean delivery and good immediate newborn care. And the development of our training was based on formative research we have done earlier. And I think that all of these approaches have increased the community uptake of our intervention.
Getting such a good start in life is really a motivating mission, Magali. Thank you for sharing this important experience with all of us. In addition to community mobilization, we also need to think about how to engage and motivate governments. And these governments need to promote and participate in social innovation. Luis Gabriel, you've been a champion for social innovation at the national and regional levels. How do you identify and then cultivate the government champions?
Well, thank you, Nancy. Well, indeed, it is important to work with the builders of communities, and these include government figures and advocates within the communities. Therefore, we need to find synergies between governments and communities around shared values, such as equity or universal access to health, or any other sustainable development goal. Stakeholders are key to rally around the sustainable development goals or the strengthening of health systems. These are the kind of shared interests that get the buy-in and the support that drives collaboration. For example, in Mamás del Rio, improving the experience and outcomes of birth is aligned with the mission of the local authorities, and it enables collaboration that has expanded beyond the initial program. Today, Mamás del Rio has become a binational frontier strategy between Peru and Colombia, and it has been embraced by the national authorities.
That's quite an achievement. We know, though, that change does not come easily. Creating a conducive environment for social innovation requires many different partners: innovators, researchers, international organizations. Diana, during this demanding COVID-19 pandemic, how do you think we can foster a culture of change?
I think that a culture of change, including social innovation in health, depends on the permanent dialogue between stakeholders. Social innovation must be flexible and dynamic to respond to various community needs and contexts. Engagement and dialogue with communities and recognition of sociocultural practices are essential to respond effectively in times of crisis, such as the current pandemic. Mamás del Rio, for example, sustains the dialogue between communities with academia, public and private institutions, local and national health organizations too. Magali has been an active leader at every level of the community's health, issues, and has also become a national champion promoting healthy practices in response to COVID. Yes. Sorry. And finally, I would say that community participation and community-based processes are fundamental in any process of change. What are your thoughts, Magali?
Thank you, Diana. In fact, social innovations need to adapt to different circumstances to respond to the needs of the communities. And what you mentioned, Diana, is certainly true. In the context of coronavirus, we found that having built capacity within the community by training community health workers was key, because it allows us to monitor the actions and practices of the communities in response to the pandemic. This, despite not having physical access to the communities, actually the rivers were closed because of the quarantine that was imposed by the government. Working with already trained community health workers made it easier to add the skills that communities needed to better respond to the pandemic. Thanks to the training of community health workers, we were able to do remote training to them on how to prevent COVID, and we were also able to send prevention packages like printed material, face masks, and soaps to every member of the communities, and this thanks to the support of Grand Challenges Canada. Also, given the shutdown of more than 85% of the health services within the area, I think that the training that we provided to community health workers was key, because that was probably the only healthcare in terms of maternal and neonatal health that women were receiving. And in addition to that, we work on the adaptation of our model thanks to the National Council of Science and Technology, so that now community health workers can not only do home visits to pregnant women and newborns, but also they can look for COVID cases. And actually, we tested this in a peri-urban area in Nauta, and we're going to soon test it thanks to Grand Challenges Canada to the areas in the rural Amazon that are remote.
This extraordinary example of adaptability to meet new challenges is really a key feature of social innovation. However, one of the remaining critical issues is reaching that last mile. Mamás del Rio reaches into remote regions of the Amazon jungle to deliver services. Magali, what is the value of social innovation in terms of being able to access these remote areas?
I think the value of social innovations is key. Actually, through social innovations, we can target community needs that are not being met by the government or private organizations, like in our case, because the government is not reaching those areas where we're going. We can do that by designing evidence-based intervention that can benefit the health of the community. Another advantage is that the innovation component can be tested, like we are doing a 2-year testing of the intervention. And if proven effective, it can then be adopted by the government or private organizations. As an example, in Mamás del Rio, we're working with a strategy that several randomized controlled trials have proved to work, which is the home visits of community health workers who can decrease neonatal deaths in up to 25%. Our innovation has been to empower these community health workers with a tablet application that can be used offline, and they can use to show information to pregnant women and newborns, and also to gather health data so that the decision makers can act on it. The data is transmitted to a coordination group, generating alerts and guiding decisions. And also, one adaptation that we have had to do because of the COVID is that for us now it's difficult to do in-person training to community health workers. So what we're doing now is shifting to video-based self-training. So for example, in the program that we're going to implement in the border between Peru and Colombia, we're going to deploy the tablets with a video component of the training so that community health workers can do self-training. And I can say that for all of this, Mamás del Rio is closing actually the distance between the communities and the health centers.
Thank you, Magali. It seems that the perception of distance can be psychological as well as geographic. I mean, after all, here we are all today from around the world in different time zones. And so distance is a reality, but it's also something that one can take in a different way, depending on your outlook on what's possible. So thank you for this. A factor that is crucial for community mobilization is always the bottom line, financing. COVID-19 has required massive economic support. Diana and Luis Gabriel, you have seen lots of different approaches to innovative financing programs. Luis Gabriel, in particular, from the perspective of the Pan American Health Organization and your interactions with the ministries of health, what is your advice for innovators trying to finance new social innovation projects?
Well, indeed, Nancy, financing is essential for the sustainability. So there are some key elements that I find that are common to many projects that draw financial support: relevance, social impact, and sustainability of the project. And the first two, the relevance and the social impact, are closely linked, meaning that support is best drawn by initiatives that make a difference and help address the specific needs of communities, and even more when they tackle specific issues that are not easily identified or addressed by what is already in place. Regarding sustainability, I would rescue two elements. First, a passionate and thoughtful leadership from within the community. And second, tapping into the existing resources, which includes engaging constructively with government and institutions willing to advance shared goals and finding synergy and mutual support. Mamás del Río is a fine example of all of these previous elements. Their work advances the goals of the community, the regional government, and their country, and that of neighboring countries, and furthermore, the United Nations Agenda 2030. Even more, the local leadership has had the flexibility to build on existing capacities and resources in shaping the response to COVID-19, because they are organized as an initiative within the community and they coordinate with their government, they can achieve an effective and efficient response to the pandemic. What are your views on these issues, Diana?
Thank you, Luis Gabriel. I think that sustainability is a huge challenge for innovators, and it could now be more difficult to achieve in the middle of the global crisis. Learning from the innovators' experiences, I would say that it is necessary to think about sustainability from three fronts. First, to ensure the organizational capacity to give continuity to the innovation processes. Second, to build flexibility within the innovation to adapt to different contexts and needs. Third, to have the ability to adapt processes and products to the needs and mission of different funders. The community must be an integral part of the sociability efforts, since community engagement can move the innovation beyond its original plan and ensure continuity by linking it to activities of daily life. Any final idea, Luis Gabriel?
Well, I fully agree with the three fronts that you brought up, and all this is especially relevant to health emergencies, when an organized response is essential to achieve what is needed. So thank you very much. Nancy.
Okay. So I see that you have all highlighted community roots and ownership, government engagement and partnership, and involvement of intersectoral stakeholders as the basis of sustainability, adaptability, and resilience. Is this a form of collective intelligence with empathy? Is that what social innovation is? Collective intelligence with empathy? Working together, I mean, getting organizations, institutions, people to work together is hugely powerful. Now I would like to turn to the audience for 2 to 3 questions. Joe, are you there? Can you share a few of the audience questions for our panelists?
Thanks, Nancy. Yes, we have a couple of questions that have come in. And so the first question that I have from the YouTube chat, and just before I jump into this question, if anyone has questions for any of the panelists, feel free to put them in the YouTube chat or the WhatsApp thread, and I'll make sure that they're relayed. So our first question is from Mafe Salazar. And Mafe is asking us, in the Mamas del Rio project, are the stakeholders, trainees, trainers, mothers, community members, understanding their role as designers in the co-design project? And specifically, do they feel that they're learning skills that could also be transferable to other initiatives or issues, for example, the COVID-19 crisis? So and in terms of responding to this question, should we go around and have each panelist give their thoughts? Magali, do you want to go first?
Sure, I can go first. Yes, we have done a lot of dialogue within the communities and also with the different stakeholders, not only the communities, traditional birth attendants, leader of the communities, the government, in order to better design the intervention. And I have to mention here that this is not easy because, for example, 65% of women deliver at home. And basically we are not, and what the government wants is that women do not deliver at home, but go to the health centers. But we know, but the studies that we have done, that the health centers are not prepared to do this by several reasons that actually it's will be long to mention. So we have to use the inputs of the community to target our interventions to what the community needs, but also that can have an impact on the health of the community, while also making it clear that in the long term, of course, we would like for women to deliver at health facilities with a healthcare provider. So yes, I will say that we need not only the community input, but the input of the different stakeholders and also the funders in order to have intervention that can have an impact in the community and that can be sustainable in the future, which I think it's a challenge for projects like this because they are very expensive, they are in remote areas, it's not easy to access, and several things that I can mention.
Great, thanks, Magali. Any other thoughts from the other panelists on this topic?
No, I think Magali has covered that pretty well.
I have another. Oh, go ahead. Go ahead.
Yeah, Magali, I think you raised a very interesting point in that on the one hand, the government would like the women to go to a clinic, but probably culturally, financially, and in terms of sustainability and all the implications for the family and the community, there's not a great match between what the government thinks would work and what the community would want. So your program actually involves the government and the solution that the community has developed. Is that not so?
Yes, that's correct. The good thing is that, for example, in our case, the regional government of Loreto understand the situation, understand that we cannot change in 1 year 100% of women going to the healthcare centers. So they understand this because of several reasons, and I want to emphasize the importance of doing formative research for this, but other regional governments don't. For example, one of the things that has happened that some regional government tell us do not include training for traditional birth attendants. And I want to mention this because in some settings, the traditional birth attendants are not well seen because they believe that they can encourage delivers at home, which is what they don't want. So we have to learn how to communicate with these different stakeholders to explain well what is the reasoning behind the design of our intervention. And I think this is key in order to have a project that can be successful.
So evidence and education seem to be critical.
Yes, all our program is designing in evidence-based. There are several cluster randomized controlled trials, as I mentioned, that have proven that home visits by community health workers in settings like this are effective, although the majority of these randomized controlled trials have been performed in Africa and Asia. And what we have done is to add an innovation, which is to put the technology in the hands of the community health workers who can make a difference and who have an impact using this technology in the community. And it is something that we are assessing.
Great. So you'll get more evidence, and that will further move the decision makers to say that's a pretty good idea. We should go with that. So,
and that's correct. And we're adding now the COVID, because the COVID came into place when we were planning actually our second census to measure the effect of our intervention. And we're going to see how it comes, the results.
That experience of evidence base should probably have a particular influence on the management of COVID and the communities which are at high risk of devastating effects. So I suppose you're measuring that.
Yes, we're measuring that, and we are also being able, and I want to emphasize the importance of to adapt to new circumstances. And in fact, we believe that in Peru, at least, the community health worker should be a person that is embedded within the health system, that should be embedded within the health system, because it can not only help to, for example, improve maternal and neonatal health, but also to be a key actor in solving a crisis like this. So we are advocating for the institutionalization of community health workers within the Peruvian health system.
Okay. Maybe you can speak a little bit to the scalability to your neighbors in Colombia and some of the challenges that represents in a different setting, but probably still along the rivers and the communities that prosper along the rivers.
Sure. We are implementing Mamás del Río in 84 communities in the Peruvian Amazon, and we received, thanks to the funding from the binational alliance between Peru and Colombia, funding to go now to the border between Peru and Colombia along the Putumayo River. And this, I think, will be an important achievement of Mamás del Río, but also a challenge, because now we have to adapt into a different system. No? The Colombian system, the health system is very different. But we're working together with the Ministry of Health of Colombia and implementers from an organization there, so that we can have an impact, a good impact also in the areas that are very similar. No? The deliveries are made by traditional birth attendants. The settings are similar, is the Amazon. So yeah, we're looking forward to that. It has several challenges, like dealing with a different health system, for example. And also in terms of sustainability, we have identified 2 models that will make us be sustainable, and those are cost reduction, trying to receive, for example, the buy-in from the government, but also the cross-selling of our intervention.
Luis Gabriel. Excuse me, Luis Gabriel, as a representative of the Pan American Health Organization, how do you see this sort of transnational initiative?
I think it's a very nice example, because although the governments may have different health systems, the values that drive them and the interests are very much shared. There's an interest in equity and getting to strengthen the health system and reach everybody. And I think from that perspective, that is what brings people to a common ground, both between the governments, but also when you are having the deliberations between the national government and the regional government, or between the regional government and the people and the communities in Loreto. They have a common interest, which is being able to reach everybody and bring equity to, have universal access to health. And I think in that way, you can move forward.
Thank you. There's several questions in the chat Joe, do you want to read those, or how do you want to handle that?
Sure, yeah. And since we just have a few minutes left, what I would suggest, there's a couple of questions. I'll just read these 3 questions, and then if each panelist wants to address one or a couple of them, feel free to. So we have a question from Rosanna Peeling about how do you bring about a culture of change in an emergency such as a pandemic? Then the second question is, how do you address the issue related to cost of implementing a social innovation when multiple stakeholders are involved as compared to the usual government strategies? So thinking about value for money here. And then the third question is, how do you incentivize the community health workers and volunteers that anchor your various interventions?
Well, so I think I can go first. It's not easy to bring a culture of change within a pandemic, especially because it just arrives and then you have to change, especially in our case where we rely with international funding mainly. The good thing is that in this case, Grand Challenges Canada, for example, adapted and immediately had a release for applications for COVID that we applied. So we were able to get funding to adapt our intervention to COVID so that community health workers can look for COVID cases, but also to send prevention materials to all the communities. We are not paying the community health workers, which is the third question. And this is something that is a challenge because in Peru is not institutionalized the payment of the community health workers. And if we include the payment, then we may face issues of sustainability if the project doesn't enter into the system of the government. What we want to achieve is that the government can take our intervention and make it easy. So we're working with the regional government to achieve this. We have accomplished for this year cost sharing with them and also the national government. That will be the ideal thing. And now that we're going to Colombia, we want to create a model in which maybe Colombia, and because we're working very closely with the Ministry of Health of Colombia, can also adopt our intervention.
I'll take on the question of the funding, and I think one of the key issues is the flexibility that was mentioned earlier by Diana, by Magali, by which the initiatives start looking at what are the main areas and the mission and the goals that each of the potential funders has, and matching to those. Some focus more on technology, and some focus more on the strengthening of the system itself, others on education. So if you just start finding the best matches, that could be a way forward to finding the funding to cover each of the aspects of the project.
Great. This was a really rich panel, and I'd like to thank all of the panelists and Dr. Saravia for moderating. It's been absolutely fascinating. I apologize, we're not going to get to all of the questions, but I would encourage folks to follow up afterwards. So now we're going to switch gears and go to our second panel, Transitioning Social Innovation to Scale, a COVID-19 National Hotline. And this will be co-moderated by Barwani and by Dr. Peeling. So over to you.
Rosanna, are you there?
Okay, sorry. Let me start again. I was trying to unmute and couldn't unmute myself. So welcome to the second panel, Transitioning Social Innovation to Scale, transitioning from the health center by phone, which is in one region, to a COVID-19 national helpline. My name is Rosanna Peeling. I'm the professor and chair of diagnostics at the London School of Hygiene and Tropical Medicine and director of the International Diagnostics Center. I'm joined by my co-moderator, Bawani Msikska, the SIHI Malawi manager. We're delighted to have a rich panel today focusing on how to scale up social innovation. And so, Bhavani, would you like to introduce yourself and the panel?
So the panel today, we have such a great and rich panel. Our first panelist is Dr. Don Matanga, who is the lead for Social Innovation in Health Initiative Malawi. He's a director of Malaria-led Center and a professor of epidemiology at the College of Medicine, but also is leading the COVID-19 public health response under the College of Medicine. Our second panelist is Upile Kachila. She's Chipatala Chapa Foni Program Manager at Village Reach. She's responsible for the overall implementation and transitioning of Chipatala Chapa Foni to Malawi's Ministry of Health and Population. And finally, we have Nedson Fosiko, who is the Deputy Director of Clinical Services under the Ministry of Health. And he's been a champion in the transitioning and scaling up of, so I'll be saying CCPF, which means Chipatala Chapa Foni, and adapting this into a national resource for COVID-19. So thank you all for staying with us on this panel. And to begin with, we know that Social Innovation in Health Malawi was established with the belief that health of Malawians can be achieved through creative solutions created by the Malawians themselves. So Dawn, how does SIHI Malawi work to identify and stimulate social innovations in Malawi?
So, good afternoon from Malawi. Thank you so much, Warani and Rosalind, for having me on the panel. Unfortunately, I have to apologize that I cannot show my face because I'm having some technological challenges, but I still hope that I'll be able to communicate. Warani Social Innovation in Health Initiative, the Malawi Hub, was founded in 2017 within the College of Medicine. We sit in the School of Public Health within the University of Malawi. The hub itself was established because we wanted actually to support the Malawi health sector strategic plan, which main operation is based on ensuring that at least there is universal health coverage of quality services through the primary health care health care system that we have in this country. But I think from the word go, the Malawi government realized that given the limited resources that the country has got, we would have to innovate in order for us to be able to reach out with quality services to as many people as is possible. Unfortunately, the whole concept, I think, of innovation in this country is a little bit kind of a new concept. When we think of innovation, we are only thinking about technological kind of innovations, and social innovation is not very much considered as part of innovation at all. So where we have social innovation is mostly not well defined, and it's operating quite in isolation, sometimes not even known at all by government agencies or other implementing partners within the area where they are working. So the Social Innovation Hub was established with an idea of really helping the country, more especially the Ministry of Health, to identify innovators that are out there in social, in health. Once we identify them through the annual calls that we do work with those innovators in trying to promote them. But at the same time, for the very few innovators that are out there that we can work with, we try as much as possible to work with them to support them in collecting data that is relevant. Because as some of the people that talked during the last panelist, I think for these innovations, for them to be known in an area of evidence-based medicine, it's important that we are able to collect information that they can use. So the team that you will be discussing Chipatala Chapafoni today actually happens to come from an innovation that we identified quite earlier on, supported in terms of promoting this concept. But at the same time, we worked with them extensively to collect data as well that enabled us to promote this both at local and at international level. So we work in that aspect in terms of supporting the innovations that are there. Thank you, Walan.
Thank you so much for that. So Upile, can you tell us about Chipatala Chapafoni, how it started? What was the spark for this innovation?
Thank you so much, Marwani. So to begin with, Chipatala Chapafoni, which is also known as the Health Center by Phone, was an initiative that was incited, I should say, by the Ministry of Health upon realizing that a lot of people, especially at the last mile, would travel long distances to get to their nearest health facility just to access information. So realizing that a lot of time was spent, as well as resources were spent for people to just access information, the Ministry of Health called upon drive for the community to innovate and come up with a solution that would address that. And in a way, that solution should also curb the maternal and child health challenges that were being faced at the time. So 2 emerging solutions came about. One was to come up with a hotline where people would call for free to get access to information and advice on issues to do with maternal and child health. And another was to come up with a messaging platform that would kind of send out reminders and tips via text messages to expectant mothers and mothers of newborn children on issues to do with antenatal visits, postnatal care, as well as vaccination. So upon having these 2 very vibrant innovations come up, the Ministry of Health, together with Village Reach, then came into the conceptualization and merge of these 2 ideas to form what we now call today as Chipatala Chapafoni. So I can say that the challenges that were there, the maternal and child health challenges that were there, but also the realization that people do not really necessarily have to travel long distances to go to their nearest health facility just to access information, whereby they can easily, call a toll-free number and access the very same information and advice, brought about the success of Chipatala Chapafoni. And that was around 2011 when all this was initiated. So after that, when Chipatala Chapafoni came about, in 2013, an impact evaluation was conducted to see how the innovation was being utilized at the community level. And the results proved that indeed there was huge impact that was coming in. You look at issues to do with behavior change, people were adapting the necessary guidelines as well as requirements in order to ensure that they're following the maternal and child health protocols as defined by the Ministry of Health. And because of this overwhelming impact that came about, plans to begin to scale up Chipatala Chapafoni beyond maternal and child health areas, were kickstarted. And that led to the gradual growth of the hotline. From offering maternal and child health information and advice, the hotline increased in scope as well as in scale. It was unlocked to cover all health topics, and it was also then scaled to different districts within the country. So from the onset, it was only available in one district, Balaka, but because of the impact, it started scaling up gradually to many other districts within the country. And as of 2018, it was a national health hotline that was accessed nationwide and was providing information and advice on all health topics. This platform is manned by trained health professionals. So we have nurses and clinicians who respond to all health questions that the communities ask. It is available 24 hours a day, 7 days a week, and people get to call for free. They do not have to pay anything to get that, to get access to information and advice. And just to add that through this innovation, we have been able to reach as many people throughout the country as possible. In a way, the hotline has ensured that there is an extension of the health center experience in every household. So in a nutshell, that's how Chipata Jabafoni came about. And just to add that, it came through the need to innovate in order to address the challenges that the Ministry of Health, as well as the health system and the communities at large were experiencing at the time.
Thank you, Apili. So Bhavani, do you have other questions that you would like to ask of the panelists? Maybe we could hear from Netson.
So we know that transitioning to scale, just as Upile, I think, was talking and explaining the process that has been, we know that transitioning to scale is a complex and dependent, it really highly depends on the social, political, and economic context. So Dr. Fosiko, maybe tell us more about the healthcare delivery system in Malawi and how this social innovation was scaled up, but really looking at what are the things that facilitated this growth in the Malawian context.
Thank you very much, Barwani, and thank you for having me here. I hope I'm audible enough, but I must say that as my colleague Upile was explaining, and what Prof. Dr. Matanga said, is the Minister of Health is mandated to ensure that there is delivery of quality health services in the country and to promote the health status of the Malawians. Because of that, there's always been means and ways the Minister of Health has tried to innovate in so many ways, trying to encourage creativity in terms so that we can reach out to the masses of Malawi. For your own information, the Health Sector Strategic Plan 2 that we are implementing now is aimed at increasing access to quality health services to all the Malawians. And for us to do that, we need to ensure that we have got enough health facilities in the country, we have got enough healthcare workers in the country, and enough all the resources that are required for delivery of health services in the country. Unfortunately, Malawi is one of those developing countries where resources may be limited. We have got very few healthcare workers, inadequate healthcare workers than what we need, and maybe the health facilities also not that a good number or that we need. For example, one health center may be saving more than 10,000 people. And again, with those 10,000 people, the people that are working in those health facilities also, they can be saving more than 40 patients, 40 clients in a day, which means that they're giving very little time to the health to the people for explanation, also to allow people to participate in their health. So because of that, there have been so many challenges. Some of our challenges are maternal and child health challenges, nutrition challenges, as Upila said, infectious diseases, common causes of morbidities in the country and mortality. So in trying to solve all this, looking at the whole continuum of care in Malawi, where the first point of entry or the first contact of a person to the healthcare system may be the health post, and then to the health center. I'm saying the health center, not the clinic, because the health center is there to provide health promotion services, and at the same time to be able to provide curative services through the outpatient department services. At the health center, we don't admit people, and possibly again, sometimes investigative services are a bit limited. Now, from the health center, people are referred to the district hospital where they can have more things to more investigative facilities like the X-ray department, the lab, and sometimes not sometimes, but definitely the theater, and people can be admitted there. Only those cases that may be very complicated and need special care, they are referred to the specialist hospital, which is the central hospital. But across, the first thing as Malawi, we would want to ensure that we promote health to prevent diseases from occurring, and also provide the basic care at the primary level so that people do not complicate. And with that, the essential health package requires us to give services that are targeted to the common causes of morbidity and mortality. Now, with the challenges that we've been having, with a lot of people walking long distances and possibly queuing for a long time, having very few healthcare workers, it is imperative that we really need to promote prevention of diseases and possibly to ensure that people present to the health facilities earlier. So there was need to innovate to ensure that that is happening, to prevent maternal deaths and child deaths. So that need, as Upile said, that need made us to call for innovation in this area. Unfortunately, we had Chipata Japafoni in this area, which has come out to be something that we're very proud of, because it is like each and every household now has got the healthcare workers in their own home, where they can consult at any time using the phone, as long as they can be able to call. Right now, we are using only one service provider for the cell phones, which is Airtel Malawi, supporting the CCPF, but we intend to engage other service providers so that anybody can call directly to Chipata Japafoni. So I can say that Chipata Japafoni now, it is provided to us, it has provided a way of making accessible health services to all the Malawians across the country, and also providing privacy, especially to the youth, for youth-friendly health services, because there's a lot of confidentiality. They can talk to the healthcare workers. Sometimes the youth shun to go to the health facility just to talk, to discuss. But at the same time, because the healthcare workers are overloaded to go to the health facility, and for people just to go there to seek information, it becomes a bit of a problem for them to get the service. But through the Chipata Japafoni, anybody else can call, and we are also not only receiving calls, but we have got a facility where people can call and to listen to recorded messages on any health topic that they need. And also, we are also calling on there, we give some referral services. If somebody calls with some symptoms, since we don't make any diagnosis on Chipata Japafoni, we don't prescribe. But if somebody is indicating some danger signs and we are able to encourage them to go to the hospital, we are able to follow them up also. And especially in this COVID period, Chipata Japafoni has proved to be very, 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 very important. Thank you very much.
Yeah, I think that's a fantastic story, because for COVID especially, I think most people would recognize we're fighting two epidemics. We're fighting an epidemic caused by the virus, but we're also fighting an epidemic of misinformation, a lot of myths about what COVID is, what it isn't, myths about the vaccine, myths about transmission, etc. So I think that having this national system of reaching every household through this health center by phone is just fantastic. So in terms of being able to do that, were there in terms of the transition to immediately applying this system to COVID, what are the things that you had to do in order to start using the phone system for the pandemic response in Malawi?
No, thanks very much for your information. Since this one was like, if right from the beginning, from the inception, the Ministry of Health has been part of the innovation, trying to seek an innovation. And as soon as the innovation was picked up accordingly and proved that it is working, it became just part of the health system. And right now it has been adopted by the Malawi. It used to be operated by Village Reach, but now it's solely operated by the Ministry of Health as just one of those health facilities where anybody else can present. So because of that, we knew that COVID cases will need some healthcare services. They will be seeking service. So there was need for people when they to prevent spread, so that we don't have congestion at the health facility. So we needed to tell the people to say, when you have got symptoms like this that may be COVID, please call Chipatajapa phone on this number. And the number 54747 has become now very popular in all the households because of the COVID-19. And it was not even a big hassle to bring in Chipatajapa phone to respond to COVID, because that's what it was supposed to be. And in future, we know that Chipatajapa phone is going to be used for so many other health-related activities that the public may need more information. So it was very easy.
Yeah. At the moment, how do you have an idea of the cost of running such a national system, and how many people work in this system, this health center by phone system?
Yeah, this is a very good question. The cost of running this Chipatajapa phone, I may not have a figures per se, but we know what we need to put up in there. We have the infrastructure and the equipment that has been installed in Chipatajapa phone. These are the phones and the computers that have been put in there for the hotline. And then we have got the hotline workers. So you can see that some of these things are once-off things that we need, though they may need some maintenance and upgrading. And the human resource itself, yeah, I'm very much keen to see what type of human resource, what training does the human resource in the Chipatajapa phone or in a hotline that is serving that purpose need to have. Because despite having the science and the background of having the nursing training and the clinical training, but maybe we may need also some customer care service there that may need to be provided to them. Training that may need to be provided to them. So the cost really includes the infrastructure itself, to put up the infrastructure and the equipment, and then to put the human resource that are working there. So their salaries are very important. The rest will be the routine things that we need, like electricity and water bills every month to be paying for that. And also, since the people need training, regular training and some refresher trainings, we need a cost to put up for that. And Chipatajapa phone is also operating 24 hours a day. We need some transport there that may be ferrying the people that are working in Chipatajapa phone every day. So those are some of the cost lines that are required in Chipatajapa phone. Right now, our Chipatajapa phone has got about 23 people that are serving there. But we can have more. That's the beauty. We can have more by connecting them to Chipatajapa phone. The healthcare workers can work from the remote, and that's what we are planning to do now. They can work from the remote, and when there are many calls, other calls will be diverted to doctors, nurses accordingly. That maybe will tag to Chipatajapa phone. So the benefits of Chipatajapa phone are looking like endless, and we are very much happy to have a health center in every homestead.
Yes, I'd like to now ask Dawn about how does SIHI Malawi work to try to identify other social innovations in Malawi and scale them up the way that this has been so successful. Dawn?
Yes, thank you so much, Rosalie. So SIHI Malawi, basically every year, we kind of put up an article through our local networks, including the newspapers, to look for new innovations that are there. And once we identify these innovations, the most promising ones, we try to work with them in terms of one, trying to understand what they do. Two, we try and see how we can link them up to ministry officials and other implementing organizations. But most importantly, I think we try and work with them to see how do you collect information, data that the Ministry of Health and other implementing organizations might be interested in. Because we understand that for you to scale up something, you have to excite people that have got the potential to help you scale it up. So data, because we live in an evidence-based world, is quite important. Two, how does this fit into the system itself, the cost of that, and whether it is acceptable to the health workers? All these are kinds of things that we try to work with the innovators for them to collect that information. Because we have already gotten this platform where we are bringing innovators together with the Ministry of Health, then it becomes a bit easier for the Ministry of Health and other people to look at what is being done by these innovators and think about how do we scale this up, if it is something that really excites them to be taken to scale. Thank you, Rosalie.
So maybe for Upile, for just a minute, if you could explain from your experience, what do you see, what words come to your mind about this process from looking at Chipatayapa phone scaling up, but response also to COVID-19, and why?
So to speak on that, I think what has been core or critical throughout this whole process has been the ultimate goal of Chipatayapa phone itself, which is to improve the health of individuals by increasing access to free, timely, reliable, quality health information, but also to be able to provide linkages between the community and the health facility, thereby extending the health facility's reach within the communities, especially in the hard to reach areas. So I think not losing focus or sight of the overall goal of Chipatayapa phone has ensured that as we adapt, as we respond even to the current pandemics and any other, as we begin to plan for any other possible future pandemics, we have to bear in mind that there is need for that access to free information, so that with that information, people would be empowered to make the right decisions concerning their health, but also they would have enough information within which to act accordingly and timely, and in a way, improving their health outcomes.
Thank you, Pili. I'd like to move to questions from the audience. I've already asked a couple of them. There is a very important question that just came up. What are the sustainability plans for this innovation now that it's scaled up to a national initiative?
And maybe for this, if Nedson, you could start, and then Upile, you can add on to that.
Thank you. For the sustainability plan, we are very much happy that it's part of the health system in Malawi. Chipatayapa phone is now just part of the health system in Malawi. And the sustainability is that there must just be a budget for this. And this is being done through the Ministry of Health. The government of Malawi is funding Chipatayapa phone. But at the same time, the Ministry of Health works with various partners. And actually, the inception of Chipatayapa phone, while the Ministry of Health and Village Reach started things, but it got support from other partners. Just to mention a few, like USAID, DFID, GIZ, and others. They came in to support the innovation to start. But now going forward, Ministry of Health is also implementing various health services in partnership with other partners that are supporting the health system. So the sustainability is there, and Chipatayapa phone, the need for Chipatayapa phone, we would want to reach each and every Malawian with health information. and Chiparajaba phone is just doing that. And also, Chiparajaba phone is helping us to respond to emergencies like what we have seen in COVID. This it has been like an entry point for people to get care as far as COVID is concerned. People were calling the health system through Chiparajaba phone, where they were being linked accordingly for testing and even for care to be monitored accordingly. Some were getting the information on prevention itself. We are also planning Malawi is developing the emergency medical services, which is going to be using Chiparajaba phone as well to respond to emergencies like accidents on the road and possibly some emergencies like coming from the NCDs, maybe from diabetes. When people are suffering in their homes, maybe they have got stroke, they may call Chiparajaba phone and then the response comes in. So that need on its own prompts the government of Malawi, prompts the Minister of Health to continue to implement Chiparajaba phone. So the sustainability is taken up accordingly because number one, the need is there and the financing part of it has been already accommodated in the budget of the Minister of Health. Thank you.
So I think we'll just quickly, oh, sorry, go on.
No, I was just saying that to add on what Dr. Fusiko has just mentioned, I think to keep an innovation relevant in order to achieve sustainability, that also calls for, continued adaptability in order to ensure that the innovation is addressing the needs that are there and is able to anticipate for any future needs that may come. So I think apart from the financing bit, but also ensuring that the technology is constantly being adapted to respond to the requirements that are present at the time would also speak volumes on how sustainable the solution or the innovation will be in the long term.
Yeah, I think that's a great way that as a health system can become resilient, right? With all the changes, because we live in such a dynamic world. Bawani?
So a last question on this, I think, is to all the panelists. Maybe if you can just speak to it for a minute, then Rosanna will close up this section. Hannah asks, I would be interested to hear briefly from each of the panelists what opposition, if any, the new approach has faced to date. So maybe if we can start with Nedson, then Upile, and then we'll close with Dawn. Then Rosanne, you can take it from there.
Thank you. That's it.
Sorry, I think, but you're asking about the opposition that maybe Chiparajaba phone has made up to date. If I got that question,
so maybe
right,
what are the big challenges? Yes, you did.
Thank you very much. I think the most thing that we have seen is not necessarily the opposition, but Malawi, our economy determines the environment in which the health services are being delivered. And health financing is an issue not only specific to Malawi, maybe, because for us to do even much better, we need more resources. And again, policies, sometimes innovations will meet some sort of like not necessarily resistance, but the innovations may require changing of some policies to accommodate the innovation. So that's one of the things, because I remember when we were trying to recruit the healthcare workers, Minister of Health, the mandate of the Minister of Health is not to operate a hospital per se, but to provide strategic leadership and guidance in the delivery of the health services. But in terms of implementing the health services themselves, to deliver the health services themselves, they're done at the hospital level, which are under the district hospital. And this Chiparajaba phone found itself not having a real home who is going to housing this Chiparajaba phone, this innovation. So Minister of Health had to accommodate that, so that we work out on how best we win off Chiparajaba phone to be able to stand on its own, to be provided its own funding and the like. But otherwise, at the moment, the funding for Chipatachapa Phone is being provided to through the Ministry of Health, and that on its own is sort of like doesn't go along rightly into the policies. But this is one of the challenges that we have seen. But we are working. We have managed to work around that, and because of the need that it has shown, the policies have managed to be flexible and will be reviewed accordingly to ensure that at least we are able to sustain this Chipatachapa Phone. And another thing is that the healthcare workers themselves, the positions, which positions are they? Are they going to be called nurses? What are they? What is the name that we're going to call the people that are working in the hotline? But right now, yes, they are nurses, doctors, and other cadres, but we would want to ensure that at least we give that cadre a specific name. But not that I can say that we have met a lot of opposition or resistance to the Chipatachapa Phone, because this is an innovation that was prompted by the Ministry of Health itself. Thank you.
Don?
I think from my end, maybe I would not talk only about this, but I would talk about all the innovations that we are working with. I think I mentioned earlier on that the concept of innovation in Malawi is a new one, especially when we are talking about social issues. So it's the idea of just selling the innovation, making people understand that you're trying to do things a little bit differently, can become a huge problem, especially when it comes to acceptance. And this is not just at the community level, but at all levels. We are part of the College of Medicine. I think even for us to convince people within that level that it's important for us to work with these young innovators at grassroots level, that can be quite a mountain to climb. Thank you.
Finally, Upili, I think, Village Reach has been a great enabler. Did you encounter any opposition when you were trying to scale up?
Yes, so from the start, I think the very first opposition that we got was within the policy framework. So getting the responsible regulatory entities within the government understand that this solution is not there to replace the health center, and it is not there to provide diagnosis or treatment. I think that was a challenge to get that buy-in from the regulatory frameworks that exist within the Malawi government. And that did delay the rollout of the pilot process itself, because there was huge resistance. There were so many questions that were raised to say, how can, for instance, a platform, only provide information and advice without closing the loop and provide diagnostic or treatment services. So getting them to understand in a way that would then show them how relevant and impactful the solution is and how it complements the health system itself rather than replace the health system was quite a challenge. But at the end of the day, we were able to get that buy-in. And then I think another challenge that we encountered during the pilot was getting the community to understand why we were innovating around this solution that we have. Many members from the community didn't believe that through Chipatachapa Phone, they would get access to certified information and advice as approved by the Ministry of Health. They didn't think that the information that they would get would be impactful enough to change their behavior, but also their health outcome. So getting the community to embrace that there is this new innovation that has been set up that is there solely to address their health challenges was a daunting task, because not only were the communities not fully receptive, but also at one point they they began to manipulate or abuse the platform. So there was really need for comprehensive community mobilization and awareness to get them to understand why the innovation came about and how impactful it would be to their health outcomes. And by, we did see the innovation being embraced positively and remarkably in a way that then, sparked the scale up of the service.
That's great. And it's a great point to get the trust of the community as well as the government to see that you're not trying to replace what they are doing or duplicate what they're doing. So I like to, on behalf of my co-host Bawani, thank all the panelists. And Bawani, you also like to say something about thanking the panelists?
So I think I'd just like to say thank you so much for such an informative panel. And I think with Chipata Jabafone and the Malawi team, we're able to see how a social innovation is responding to the present while adapting and designing it for the future and our changing health priorities, which I think is a very core element of what social innovation is, and especially in these times of COVID-19. Thank you.
Thank you very much, everyone, for all your insights. It's been really great. And now back to Joe.
Thanks, Rosanna and Barwani. So our final panel today is going to be moderated by Dr. Noel Juban and Abigail Meyer. Over to you, Noel and Abby.
Okay, welcome everyone to the third panel for social innovation response to emergency. I am Dr. Juban, the SIHI Philippine Hub Lead, and together with Abigail Meyer, which is part of our team, we will be moderating this panel discussion. With us right now are some of our partners in health and the development from the Philippines who are instrumental in introducing, implementing, and sustaining social innovation in response to health emergencies at the community. Joining us for this discussion is the Honorable Vice Mayor Alfredo Coro of Del Carmen, one of the Philippines coastal municipalities. Vice Mayor Coro was an awardee in our 2017 Social Innovation Call for his Seal of Health Governance program that encourages community to be actively engaged in addressing health concerns through open participatory competition with incentives.
Together with Vice Mayor Coro is the Deputy Executive Director of the Zulig Family Foundation, Dr. Anthony Faraon. The Zulig Family Foundation is one of the development partners of the local government unit of Del Carmen. The foundation is known for their work in enabling local health systems to effectively achieve better health outcomes through leadership and governance in partnership with key stakeholders.
Lastly, we also welcome one of the academic partners of Zulig Family Foundation in implementing their training programs on the ground, and my co-lead for the SIHI Global Network Secretariat, Dr. Meredith Labarda of the University of the Philippines, Manila School of Health Sciences. The School of Health Sciences is known for its innovative stepladder program that recruits students from the communities and train them to be clinically competent and socially conscious health professionals who will stay and serve in depressed and underserved communities of the country.
We deeply thank our panelists for joining us today. So as we have heard from the previous panel discussion, social innovations have become very relevant, especially in this time of the pandemic. And for many low and middle income countries like the Philippines, health emergencies have added to the challenges that communities face, especially vulnerable communities living in geographically isolated and disadvantaged areas. So for our first question to Vice Mayor Coro, can you please tell us a little background about your municipality of Del Carmen and how you have responded to the COVID-19 pandemic?
Um, Good evening to everyone from the Philippines. Del Carmen is located in the island of Siargao. It is the 2019 #1 island in the world, according to Condé Nast. Again, thank you for the opportunity to be part of the health innovation discussions. The municipality of Del Carmen, with its experience in health reforms and innovations, responded early to the pandemic and was able to project its potential impacts. As early as February 2020, we already had a team that was formed to look into the potential issue of COVID-19 to our community. And by early March 2020, we had regular discussions with stakeholders that resulted to immediate agreements and policies and financial capacity to respond for at least 6 months. Our social innovations include: number one is hunger management. Immediate campaign on farming and sustainable fishing was done. We did weekly distribution of rice subsidy for almost 4 months so that the family will manage rice consumption. We didn't do it in one bulk, it was weekly. And donations were managed for equitable distribution to the most vulnerable families. We also focus on continuity of livelihood. The COVID pandemic is not just an issue on health, but also the economy. We purchased locally grown rice that we distributed to the different families. We set up mobile markets for vegetables and other produce and negotiated with partner communities to allow our fish and marine resource trading to continue. We immediately opened the ecotourism program once we reached more relaxed quarantine status with proper health protocols. We also launched, to support our transport group, which was gravely affected by this pandemic, we launched a local public logistics system with a local public transport group to help increase their income by acting as delivery for the online market we launched in the municipal social media account. So you can now buy your goods locally through Facebook. And third is the health risk reduction. We have a return to Del Carmen call center to manage the entry of returning residents and at the same time prepare our health system's absorptive capacity. We also launched the Del Carmen Telemed Services and Center, which is now for expansion to become the Siargao Telemed Services and Center, supporting the 9 municipalities of the island to offer continuous access to health services despite limited mobility, especially for our senior citizens who has comorbidities. We also focus on border security, including seaborne patrol and land-based mobility, checking to manage entry of high-risk individuals, either for testing or quarantine if necessary. So those are the quite a few number of innovations we have done in the past 6 months.
Thank you. It's great to hear about these innovations, Vice Mayor Coro. I noted that these innovations were implemented in collaboration with different development partners. Can you describe to us how your partnerships work for these innovations?
The idea of innovating governance and a multi-stakeholder approach towards health we implemented in Del Carmen was through a capacitation effort as part of the Zuili Family Foundation's Community Health Leadership Program we joined in 2012. Through the program, we launched the Seal of Health governance that allowed our communities to meet a health standard and be rewarded with incentives and the bragging right to be classified as a healthy barangay or community. Since we have been running the program for 6 years already, the communities and our development partners have understood their role in achieving the desired health outcome. The complexity of the pandemic response needed various sectors to work harmoniously with each other in understanding the root of the potential social problem and thus developing a solution to address it. During various consultations, even prior to the pandemic and during the pandemic, as we rolled out the programs, we realized that for our community, we needed to manage hunger, livelihood, and health risk to secure the people and their hope. We also regularly communicate the issues and actions to the people in various media. We even used a large speaker connected to a mobile car that goes around in the different communities to announce health protocols if mobile access is not available. From the start of the pandemic, I also had a chance and a privilege to work with the provincial government as consultant on the COVID response and recovery strategies, which led to a fairly manageable status for the province of Surigao del Norte, despite being the gateway to the island of Mindanao. We are entry to 27 provinces and 33 cities. They trusted our experience in health governance and allowed us to participate in the process of identifying strategic initiatives on the provincial level. As of today, the province of Surigao del Norte has 0 active case of COVID.
That's really wonderful to hear, Vice Mayor Coro. Now we see how the Zulig Family Foundation comes into the picture when it comes to your collaborations. Dr. Anthony, Dr. Ni, can you please give us an overview of what the foundation does and more about your partnership with the municipality of Del Carmen?
Well, firstly, I would like to express my appreciation to the organizers for the invitation to briefly share the Zulig Family Foundation's innovative work. As a response to the question, let me first inform the audience that the Philippines has a decentralized health system as a result of a law enacted in 1991. This decentralization entrusted to local chief executives, such as our previous speaker, Vice Mayor Coro, the power to shape the healthcare delivery system. This was done in the hopes that local government units would become more accountable for the health of their constituents. The initial challenge was that these local chief executives had limited education, limited expertise and experience in running local health systems. Roles of the national and local governments weren't that clear or weren't that clearly delineated. So this led to problems on coordination among the different levels of the healthcare system. As a result, many rural and geographically isolated and disadvantaged areas experienced underfinancing of health, poor morale of health workers, deterioration of infrastructure, and decline in health service delivery, all of which only furthered the apparent inequities between the urban rich and the rural poor. So as a response to these challenges, the Zulig Family Foundation shifted its focus to health for the rural poor and participated in the government's health sector reform agenda by helping make access to health more equitable and pro-poor. So 2 critical areas of intervention were identified at the time: governance and the health service delivery. So to implement this, a development strategy was crafted, and we called this the ZFF Health Change Model, or HCM, which was derived from the Bridging Leadership framework of the Synergos Foundation, and in the Philippines of the Asian Institute of Management Center for Bridging Leadership. The model suggests that in order to have better health outcomes, the community must have access to health services made possible by a responsive health system, which in turn is transformed and managed by committed leadership. So Del Carmen's partnership, Mayor Coro's partnership with us, started, as he said, way back in 2012, when then Mayor Coro and his municipal health officer were selected to join our program because of their commitment to health reform. Over.
Thank you. And So great to hear that the Zulig Family Foundation has a lot of work involving the local government units, as you mentioned, with engaging local chief executives through this leadership program. It's quite impressive that you were able to scale this program nationally. Could you share how the foundation was able to do this?
Well, the foundation pilot tested the HCM at the municipal level. From a pioneering cohort of 9 LGUs in 2009, we had implemented the HCM in 72 municipalities in 9 cohorts by 2013. The foundation trained mayors and their teams, and through trainings, practicum, and coaching, they were able to understand the gaps and inequities in their respective health systems and identified the actions needed to address those issues. They carried out reforms and programs that made health services available and accessible to their constituents. The HCM, or the health change model, showed that mayors can become champions for health and drivers of change, as evidenced by their municipalities' improved health indicators. Because of these positive outcomes, our Ministry of Health, the Department of Health, and other development agencies such as the USAID, UNFPA, and UNICEF started partnering with the foundation. In late 2012, the DOH invited us to share our approach for implementation to cover 609 additional priority municipalities in the country. So the prospect of scaling up paved the way for ZFF to develop a partnership program, a formal partnership program with the Ministry of Health or the Department of Health for the nationwide replication of the HCM. And this was through what we called the Health Leadership and Governance Program, or HLGP, which included transfer of technology, capacity building of regional academic partners, and provision of resources, funding, and other necessities to facilitate the responsiveness of local health systems to the needs of the poor. Through training conducted by, I think, 11 academic partners or partner academic institutions, the program reached 797 municipalities by end of 2018. And taking off from the results of the municipal interventions, we started engaging other partners to expand the reach of the HCM. So we started working with the Ministry of Health regional offices and directors through our Bridging Leadership Fellowship Program for them, and also engage the higher level of the governance system in the country, the provincial level, whereby we engage provincial health leaders through the Provincial Leadership and Governance Program. Over.
With what you have shared with us, it seems that you highlighted the importance of your regional academic partners. You mentioned about 11 partner academic institutions to reach more municipalities and local leaders. With that, I would like to ask Dr. Meredith Labarda to share her experience. Doc Medith is one of the pioneer academic partners of the Zulig Family Foundation for the Municipal Leadership and Governance Program, which Doc Tony just described. Doc Medith, would you like to share with us what role did the academe play in these partnerships?
Great question. Thank you, Abby. It is good to listen to the journey of the program while Doc Tony was talking about it earlier. I think I want to start by saying that the partnership processes itself that the foundation went into and were one of their partners on the ground is a social innovation in itself. Because we operate in the context of systems framework, we use multi-stakeholder and participatory processes. It's unique in a sense because the academe plus the civil society or the private sector. It's partnering now with the government to empower communities. So there are strengths to these partnerships. For example, the private sectors, as what Dr. Tony has been mentioning earlier, they have the resources, they have the technology, they have the networks, they have the expertise, which is sometimes not all of these are present on the ground. The academe, on the other hand, we have the objectivity. And since we're apolitical, meaning we don't, in a sense, because we are not with those who wield political power, this is very important in the program because we were training local chief executives, okay, mayors and their municipal health officers. It is expanded to train governors and other government partners. So we have, thus the academe has the legitimacy and the moral authority when we work and partner at the community level. So it's also important to emphasize that the partnership with the foundation and the community is actually mutually reinforcing, and it's potentiating. Why? Because first, the academe is able to ground the theories and concepts that we teach our students. You see, the University of the Philippines School of Health Sciences, we recruit students from far-flung municipalities, train them to become midwives, nurses, and doctors. It's the last step of the ladder, and send them back to their community. So what we teach them, if this is grounded, it's very important because they apply this later on in a similar situation. So we also touch base with the community and their community leaders by providing the learning environment. So we share with them tools, we do coaching, as Dr. Tony mentioned. We assist in program implementation, feedback, monitoring, research, documentation. Basically, it's co-creating everything, no? Co-creating programs in the community level. So we'd like to affirm what Vice Mayor has been doing in the municipality. Their inputs also to the academe, how we teach, the feedback from the community is very reinforcing. So in the end, I think the overall goal of the partnership is better health, and not only health, but development outcomes. And this is all through empowering the communities, because we want health. At the end of the day, we want health in the hands of the people. Over to you, Abby.
Thank you, Doc Medi, for your sharing with us your experience and your insights. So we see that there is a very important role of the academe, very unique in these types of partnerships as well. Mentioned by Dr. Tony, connecting to different stakeholders are very powerful in providing a platform and for the system to come together. And I think at this point, we will open the floor for questions from anyone who would like to ask, perhaps 2 or 3 questions before we wrap up.
Thanks, Abigail. And I think there's a WhatsApp thread question. Actually, no, I don't see one on WhatsApp. In Zoom, I don't see any there either. But I think this has been a really fantastic panel, and really, really rich and detailed. And congratulations to Mayor Coro and the team and Del Carmen for the work that you guys have been doing. It's really impressive, and I think lots to learn. And I think what we'd like to do, if it's okay, I know we're sort of coming up right against the end of the presentation. We have a very brief survey that we'd like to give to folks. And then at the end, after the survey, we'll have people complete this brief survey. And then at the end, we'll have a few brief concluding remarks. And Jing Jing, do you have the survey link? Could we put it? Oh, there we go. Thanks, Jing Jing. So if you look in the Zoom group chat, it's there. And if I'm going to put it into the YouTube. Oops. And if we could put that into the YouTube chat as well.
Joe?
Yeah.
Yeah, yeah. Okay. I just would like, I would like to thank Mayor, Vice Mayor Coro, Dr. Tony, and Medit for sharing how the social innovations and how the partnership has been ongoing and helping, and also trying to see that it takes a lot of it takes cooperations between the partners to make the innovations sustainable, and also the leadership recognizes their role in in helping the health of their particular communities and constituents. And it is a good example as well. And I know there is a platform that they share the experiences of the local mayors and the governors as well, that is being done on an annual basis. So where they can show the fruits of their partnerships and innovations. And that's all. So that now back to you, Joe.
Thanks. And we got one question from YouTube. How do you ensure that the trained workers actually go back to their rural communities to serve?
Oh, that's for Medit.
Do you want to tackle that one, Medit?
Good question. Yeah, when we recruit students, they sign a contract with us, and we don't have walk-in enrollees. It's a partnership with the community. So their community sends them to us. So it's a tripartite agreement between the school, the community, and the Ministry of Health. So they're all scholars. The university and the country pays for their education, and part of that agreement is they go back and serve their communities.
Great.
Back to you, Joe.
Thanks. Thanks again to all the panelists for this really wonderful set of presentations, very interactive and lively. And what SIHI Philippines has done is really impressive. And I think we're very fortunate that the team is now taken on the helm of the SIHI Secretariat and is leading the network. So just in terms of final wrap up, I'd like to invite Dr. Halpap to give a few concluding remarks, and then we'll finish up. Over to you, Beatrice.
Thank you, Joe. It's working. I was muted and couldn't unmute. Well, this was very impressive and very inspiring, I must say, and to be able to share so much of an experience, it is really amazing. And I think what is very much coming out of all this discussion in regards to emerging diseases response is very much the adaptability of social innovations. It seems that social innovations are indeed engaging with communities, get the trust from communities. And we've heard how we have collective intelligence, how evidence make a difference in bringing actually the health system closer to the people who can't reach it. So I think in this all three panels, there was this adaptability, accessibility of remote areas that came very much across. And then definitely in terms of reaching the most vulnerable people, the people that reaching the last mile for universal health coverage, social innovation has a role to play. So this, having said that, then it really brings us to the next level of better understanding, as some of the questions were saying, what are the oppositions, what are the enabling factors, and leading to actually answer some questions through the research. And this is something that SIHI and TDR and others, hopefully together, we can work on as a follow-up from this panel. So we'd like to thank you all in the name of SIHI, the name of TDR, thanking TDR donors and thanking CEDA with additional funding for these initiatives, thanking all the hubs and especially the one today, China, the SIHI Secretariat, the SIHI Philippines, and importantly, Joe, thanking you for facilitating. I don't recall that you have introduced yourself, and I'd like to just briefly say thanks, Joe. Joe Tucker is the lead of SESH, the SIHI China hub, and has been really promoting the approach and getting the network together. So we'd like to thank Joe very much. And of course, thanking all the moderators and the panelists and all the participants. And I've seen in the chat, so yes, this will be shared. You can watch it later, and definitely will enjoy having more discussions with those interested. So this event was part of the first, actually, SIHI partner digital workshop. And this is an open session, and there is a second open session that will take place on the 7th of October. So we invite you to join, and it is to meet the social innovators. Thank you, all of you, for the organization, the SIHI Secretariat, SIHI SESH, and SIHI Philippines of this really successful event. Thanks. Over.
Thanks, Beatrice. And I think it's really, I'd like to second all of there's sort of a long list of people who made this happen, and it's Jingjing and Jean and Joe Reb, and I could kind of the SIHI Philippines and the SIHI Secretariat and the SIHI China SESH team, Wei Ming and Anna. I mean, it's sort of a big team. So thanks to everyone who's made this happen. And I think for me, it's really, you think about COVID and people staying at home and grounded, and this is really sort of an exceptional opportunity for community-based action, for community-driven social change. It's really, it's a prime opportunity for social innovation. So I think it's one of the silver linings of COVID, as I see it, is to drive social innovation and to make us think in creative new ways and to test our limits. And we've seen today in today's panel in the Philippines, in Malawi, in Peru and Colombia, how this has happened. And as we mentioned before, visit the website, check us out. There's also a SIHI Partners Resources website that the Foundation Mario has kindly organized, and you can see the link on the screen. Our next event on October 7th, and if you haven't registered already, you can email the Gmail address there. So thanks again to everyone. Really enjoyed this panel discussion, these set of panels, and hope to have more opportunities to chat with you in the future. Thanks. And I suppose for those who want to chat, or if there's interest in further discussions, we can certainly field questions. I'm gonna stop the screen sharing.